My name is Haval Saadlla, Dr. Saadlla. I'm a pulmonary critical care and sleep specialist. For pulmonary diseases in this area, we see many patients with what's called chronic obstructive pulmonary diseases. And what does that mean? Is there is something is irritating the airway on a long term, and that thing's most likely it's smoking. Patients will present with coughing, shortness of breath, phlegm production, and obviously there are some of them they will have frequent visiting to a hospital complaining of the shortness of breath. Many of them they will come and say, "Doc, I have chronic bronchitis," which is the same name for COPD or chronic obstructive pulmonary disease. Or some patients they will come and I will say, "I was diagnosed with emphysema," and all those same chronic bronchitis, emphysema patients, sometimes they don't understand that it's the same basically disease. The way we diagnose it is going to be by what's called pulmonary function test, a breathing test, which is we do it in the hospital here. And that's basically patients will breathe through a kind of tube, and we would know exactly the lung capacity. And sometimes just based on the symptoms, if the patient they have it, then we will diagnose them with chronic obstructive pulmonary disease or COPD. The way we treat this disease, the main thing obviously will be the hardest one for the patient is to quit smoking, or if the secondhand smoking exposure, that's going to be the key. If they don't do that, unfortunately, it's very, very difficult to treat this disease. And we have new treatments nowadays. In the past, COPD, we will have patients that will be under impression they will die and they will have a problem with their life. And nowadays with the new treatments, things has changed some. They will breathe better, but again, that does not mean they should not quit smoking. Still they have to do, that's the cornerstone for the treatment. They have to quit smoking. Pulmonary rehab, luckily we have it here in the hospital also, we can do it. And for a smoker, then what we do at least once a year, they have to do a CAT scan of the chest, and that's called low-dose CAT scan or lung cancer screening program for patients if they are older than 50 years old up to 74. And for females, sometimes actually we start earlier, maybe at the age of 45, because they are at higher risk of lung cancer. And unfortunately, we see patients here with lung cancer at young age because they continue to smoke and with the diagnosis of COPD. Typically, we tell patients if they don't have symptoms and they are younger than age of 50, then they don't need to be worried about anything. Their lung would be, it takes about anywhere 3 to 5 years to get to normal, because as we age, all of us, we're going to lose some lung function. For a smoker, it depends if they were a heavy smoker. And by the way, heavy smoking means if you smoke more than 6 cigarettes a day. Some patients, they think you have to smoke 2-3 packs. No, it's about 6 cigarettes a day, then you consider a heavy smoker. So if you quit and you're young and if you don't have symptoms, at this time you don't have to worry about anything. If you have history of more than 20 years of smoking, 1 pack a day, and you're older than age, again, 45 to 50 to age 74, then you need to have what's called lung cancer screening program to make sure that you don't have cancer. And you have to have this CAT scan done every year. So annual low-dose CAT scan, and that has been proven that it lowered the risk of future cancers in those patients population.